And there are some findings that are positive in this poll as well. Overall, about 70% of respondents said they are happy with the quality of their care and have described their current care as affordable. But it's not the current cost and quality that is so many sounding the alarms. It is that uncertainty about what the future may hold. Dr. Omer Awan is with us now to go deeper in on this. He's a professor and the vice chair of education at the University of Maryland's School of Medicine. Dr. Awan, thank you for being here. Whether it is the findings in this poll, our series on premium pain, the reporting from our stations around the country, it seems people right now are really, quite frankly, scared of what healthcare costs could be in the coming year. What is that impact from your perspective?
Well, what this poll shows, Andrew, is that Americans are deeply worried and concerned about healthcare and the rising costs in healthcare. And if you take a look at one of the statistics that you pointed out, 4 in 10 Americans would forego treatment because they can't afford it. I mean, that should be heartbreaking for anyone or any American that's listening to this. I mean, it should be 0 out of 10 Americans that are, would forego care because of cost. We are one of the wealthiest, if not the wealthiest nation on the globe. And it's unacceptable that 40% of Americans can't afford their health care. If you look at healthcare insurance, it should be a source of protection for Americans. But instead, I'm afraid to say that it's become a source of stress and anxiety for many Americans because of high deductibles, high copays, high surprise bills that they're not aware of. So it's certainly a fragmented system, and it absolutely needs reform going forward.
Yeah, and that was one of the findings that really stuck out to me as well, this idea of people just foregoing altogether medical treatments. What sort of impact could that have, not just on the individuals who have to make these decisions, but on the system as a whole, if you have as much as 40% of the country not getting needed treatments that ultimately can compound and lead to worse outcomes?
Exactly right, Andrew. Worse outcomes is the answer there. We're going to have exacerbation of many chronic medical conditions, things like, diabetes, obesity, heart disease. Imagine trying to get a medicine to cure your heart disease, but you can't because you can't afford it. Well, then over time, that's going to result in people getting sicker and then using the hospital much later on when they need it, and often when it's too late. And that's going to result in actually soaring healthcare prices even more, because what happens is that because you can't prevent a certain disease from occurring, you go to the hospital and you seek emergency care when it's too late and when the price will be insurmountable. So it actually is to the benefit of the federal government, to the benefit of healthcare organizations, to make sure that healthcare is affordable so we reduce costs in the long term. And I think that's an important piece to what insurers and policymakers should consider going forward with respect to healthcare.
One of the positive takeaways from this survey was how Americans, by and large, are happy with the quality of their current care. Does that square with what you see? People generally like their doctors. They feel good about the care that they're currently getting, but just worry about how much it's going to end up costing them?
Well, first of all, I'm not sure how positive this really is, Andrew, when you consider that 50% of people are saying that they find it affordable. That means that half of Americans don't find it affordable. So to me, that's not quite a positive. But I do appreciate your point in saying that, many Americans do come and they're satisfied with the care they get because, they have good rapport with their physicians, or they have good rapport with their healthcare team, nurses, PAs, et cetera. And that's an important piece of the puzzle, because there needs to be trust in healthcare, and there needs to be this idea of confidence, which we know has waned with time when, with the administration and, federal government and, many people casting doubt on some things like vaccines and things of that sort. So that is certainly a positive, and I hope that that increases, and I hope that people continue to have confidence in health and public health. And I'm pleased to see that the rapport between physicians and patients is successful, because that is the core of health. The patient-physician relationship really forms a foundation for healthcare. So as that grows and that continues to be developed, it will be a positive thing going forward.
I've heard people say in the past that this country is great at caring for the sick, but not as great at preventative care to keep healthy people healthy. You mentioned individuals who maybe can't afford medication that ultimately end up with a trip to the emergency room because of it. Is that true in your experience, that this is a healthcare system that is much better at caring for people when it is an emergency situation than it is for helping people prevent from getting into that situation in the first place?
I would say it is true, Andrew. And the reason for that is that because oftentimes healthcare policy is reactionary as opposed to proactive. We often, only treat people once they're sick, but we should be increasing and promoting preventive measures. If you take a look at something like lung cancer screening, for example, lung cancer screening with low dose CT should be offered to certain people, particularly smokers and people who are between the ages of 50 and 80, to find cancer early so that we can prevent it when it becomes too late or when it's end stage. Less than 20% of eligible Americans who should be getting screened for lung cancer are getting screened. I mean, that also is heartbreaking when lung cancer is the deadliest of all cancers. And if we were to prevent this, we could decrease costs and we could keep people much healthier. But because we don't invest in prevention, this is a problem. And this is precisely what you're saying, that we often treat people when they're sick, but we don't treat them and prevent certain bad health outcomes from occurring. And I think lung cancer screening is a clear example of that.
So where do we go from here? Is there anything we can do from your perspective to stop this seemingly endless cycle of every year around this time, Americans look at their health insurance, whether they're getting it through a public exchange, whether they're getting it through an employer, see their rising costs and a lot of uncertainty around how much to budget for care come the next year?
Well, I think what we have to do is that we have to, first of all, educate people about prevention. That's the number one thing. There needs to be public policy and healthcare policy that addresses also affordability. Affordability should be a right for all Americans. But why is it that the Affordable Care Act tax credits are going to expire at the end of December if Congress doesn't act? We should be acting. I mean, we talk about this, shutdown as being Republican versus Democrat, but the real casualties are the American people because we're the ones that are suffering. So really, policymakers need to strategize and put American people's needs first. And I think if they do that, then we can really move the needle in improving healthcare and resulting in more affordable care.
All right, Dr. Omer Awan, thank you.